So I'm joined by a special guest today, Ryan Murray from the ASN policy team. Ryan, how are you?
Doing well. Doing well. How are you?
I'm good. So have you been enjoying the World Cup?
I have. It's been fun watching this kind of spectacular run that the U.S. men's team is on.
So besides the US men, who else are you rooting for?
Well, obviously, I think everyone around the world is hoping for Messi to ride off into the sunset with another win, and would love to see him to continue to stack on his personal achievements as well.
So Argentina and the United States. Interesting. I too am rooting for the United States. I have to say I've also been enjoying the run that Egypt is on, and I think if depending on how the bracket unfolds or when people listen to this, it's possible that Argentina and Egypt will play each other in the round of 16, which would be interesting. So should we jump into our topic of the day?
Yes, let's.
So the White House Office of Management and Budget is really the administration's way to focus on both discretionary spending and also think about entitlement spending. And so can we just sort of talk through their recent proposed rule and the implications for the community?
Yeah, no, absolutely. I think when most of our listeners think of the Office of Management and Budget or OMB, they immediately think of how the president prepares his annual budget. But the management in OMB is really the authority to write government-wide rules that affect every federal agency, policies that can affect agencies that our listeners most know, like the NIH, CDC, HRSA, NSF, and others that administer kidney grants. And OMB recently proposed a 400 plus page rule titled Regulation for Federal Financial Assistance that's going to make sweeping changes to virtually how every federal research grant is awarded and managed, beginning in the federal government's next fiscal year, which starts on October 1, 2026. So right around the corner for our listeners. And as I mentioned, the rule would really affect the entire biomedical research ecosystem from universities and researchers to professional societies like ASN, and ultimately the patients that nephrologists care for. And so to summarize and quickly answer your question, OMB is saying that this proposed rule is intended to hopefully improve accountability and strengthen oversight or federal dollars and modernize the grant management system. But I think the real question isn't whether there should be oversight of federal research funding. There absolutely should be. But the question really is here, how are we going to preserve the scientific process that has produced so many breakthroughs that kidney patients, especially, are benefiting from while ensuring accountability to taxpayers?
Yeah, so picking up on the World Cup theme, I mean, one way to think about this is something that's unique about soccer historically, or football in most of the world, is that, once the players start the game, while there is some coaching from the sidelines, it's not a sport that's heavily coached sort of during the game if you compare it to American football or even baseball. I'm sort of curious as to using that as an analogy. It sounds like the proposal would be going from a sort of free-flowing research environment where there are guardrails, but once proposals are submitted and approved, there's a lot of freedom, if you will, for the research community to one that's much more administered by the federal government. Is that kind of a reasonable quick summary in comparison?
Yes, that's one of ASN's concerns with this proposed rule. There's obviously a cumulative effect of the entire proposal that's going to make it harder for the biomedical research community. But the first one that you just hinted on, the proposal shifts more decision making toward political review after a peer review. The normal scientific review process has already occurred. Again, as I mentioned, I definitely think elected leaders should have a say in setting national research priorities. And in fact, Congress already does that through the appropriations process. But once those priorities are set, scientists, not politicians, should really determine which projects represent the best science. These are two existing complementary roles and really have made the United States the world leader in biomedical innovation. So any change in that process definitely injects a level of uncertainty and could have a negative harm on not just, again, the research that's being funded, but ultimately patient care downstream.
I know it's hard for you to answer this because you don't work for the administration, but do you have a sense as to why the Trump administration's gone in this direction through OMB?
I think it's because they've tried to establish a number of policy changes through either executive order or pushing funding decisions through Congress that just haven't been upheld. And so they're trying to go about the standard traditional rulemaking process that will kind of really codify their decisions moving forward and would make it much harder for future administrations to undo.
Okay. So you had mentioned one of ASN's concerns. What are some of the other concerns? And I do want to, by the end, sort of circle back to the rulemaking process and just make sure we're clear on how we think this is going to play out, because there is a sort of, usually there's a standard pattern. I know sometimes there are some deviations which may happen here. So what are some of the other concerns?
So another concern ASN has is preserving stability for long-term research. Obviously, our listeners know that kidney research doesn't happen in 1 or 2 years, and that studies on both the progression of kidney diseases, transplantation, or rare kidney diseases take many years. Researchers need confidence that if they're doing good science and meeting their obligations, that their work won't be interrupted simply because the administration's priority change, and this proposed rule would allow political interference or grants being terminated more freely. And so if grants become less predictable, researchers may avoid more ambitious longitudinal projects. And then another piece that I wanted to highlight is that ultimately funding research really only matters if the findings are shared and shared widely. Research doesn't improve care until it's published and challenged and incorporated into practice. And so professional meetings, journals, and scientific collaborations really are how that happens. And ASN worries that this proposed rule could make the dissemination and collaboration of science a little bit more difficult, causing, again, patients to have to wait longer to benefit from new discoveries.
So just to summarize, it sounds like as we take a step back and look at this proposed rule, it's the first concern is this issue of shifting it from the scientific expertise to the political perspective and sort of politicizing research and science. A second concern is the lack of sort of long-term commitments and the ability to really stick with research that's promising to see it to the end to produce the highest quality results that will ultimately improve patient care. And then the third concern is that we have built up an infrastructure that's really a public-private partnership around as discovery goes into, as it's communicated either through peer-reviewed publications or through presentations at meetings or poster presentations, et cetera, that there is this discussion. I'm just curious if on this third one, you could help me understand why you think the OMB proposal would affect that.
So in the proposed rule, OMB is limiting the use of federally funded dollars to help defray costs for conference participation. So individuals attending Kidney Week and presenting posters or participating in lectureships. It's also prohibiting the use of federal funds to help defray costs for journal publication, again, trying to disseminate final findings.
So, and it's interesting too, because while you're focused on helping to draft ASN's response, and we'll talk in a second about what else ASN's doing to respond to this proposal, I've been spending a lot of time with my counterparts in other medical specialty societies, and then more broadly, the kind of meetings industry, if you will. And I think it's important for people to realize that meetings like Kidney Week are huge economic engines for local communities. So both the city of Chicago and the city of Philadelphia estimated that Kidney Week generates about $35 million for the local economy. And so you think about this just from an economic perspective. Let's just remove the sort of scientific piece, which is the focus of our response. And you start to think about kind of unintended consequences or aspects of this that could be devastating to the economy. And I think it's just interesting as we think about both the administration, but also Congress and concerns around the economy. It's just another element of this that, again, wouldn't be part of ASN's response, but I think is an important aspect of this discussion.
I think it's important to highlight for our listeners the points that you're just touching on. In fact, that there are both unintended and intended consequences with this proposed rule, but uniquely to this proposed rule, and that often during the rulemaking process, proposed rules are put out for public comment for typically 90 days, particularly for those that are this significant and this far reaching across the entire federal government. But OMB has only opened the comment period for 45 days, while still hoping to push forward with a final rule being implemented on October 1 of this year.
Yeah, and I guess that's another sort of nuance here is a lot of times when we talk about proposed rules, and in future episodes, we'll talk about proposals related to the Medicare ESRD program and the Quality Incentive Program, the physician fee schedule, et cetera. those are all calendar years. So they come out over the summer. There's a lot of back and forth. Organizations like ASN respond by the end of the summer. Then the final rule, HHS, the Department of Health and Human Services, tends to take these comments into consideration. And then when they issue the final rule in November, it goes into effect at January 1. So there's a lot more time. So the fact that the time horizon is so compressed because of the federal year starting on October 1st is a really interesting point. I'm glad that you've emphasized that. So curious, how's ASN responding to this proposal?
Yeah, so we will be submitting a detailed comment letter. Our comments really focus on preserving rigorous peer review, long-term research stability, scientific collaboration, dissemination of research, and preserving research that addresses kidney health disparities, all topics we kind of discussed here today. We're also working with other kidney organizations to ensure policymakers hear a unified message coming from our community, as well as working with larger coalitions representing the House of Medicine, all coalitions that I think our listeners know about: the American Medical Association, the Coalition for Health Funding, Research America, the Ad Hoc Group for Medical Research, recognizing that this proposed rule isn't just going to be impacting the kidney community or even just the typical science and medical research community. This proposed rule is impacting every department across the federal government. So you can imagine environmental research grants coming out of EPA, DOJ providing some funding for local federal or for local emergency response teams, et cetera. So this is a very significant and impactful proposed rule.
Yeah, and I think, as we sort of shift into sort of how this is likely to play out. So when are the comments due?
Yeah, so that's the good news, is that the comment period is still open. OMB is accepting comments until Monday, July 13th, and I would encourage every member of the kidney community to respond individually and share how this proposed rule will impact both the nation's kidney research ecosystem and ultimately kidney care.
And I do think it is interesting, since we keep circling back to the World Cup, it is sort of timed because that's close to when the final is. At the end, I'm going to ask for your finals prediction, but we'll get to that in a second. So I guess as we speculate on how this is likely to play out. So the comment period ends on the 13th. They're going to receive comments not just from the nephrology community, but from the House of Medicine, as you said, as well as from other industries. This affects pretty much every part of our economy. I'm not sure how they're going to process all those with such a short period between now and October 1st. So it's likely there probably won't be significant changes to the proposal when it goes into effect October 1. And in all likelihood, then there'll be a series of lawsuits and other sort of, unless Congress intercedes, which I guess is another option here. So just curious if I were to hold you to two predictions. So the first is, how do you think the proposed rule is going to play out?
Yeah, as you mentioned, OMB is supposed to be reviewing all of these comments. And so hopefully based on this feedback, OMB will ideally rescind the rule outright. That's what ASN is pushing forward, or at the very least substantially revise it in a way that kind of preserves the strengths of the current system while, again, still promoting that accountability that OMB is seeking. However, again, just given the short length of time, the number of comments, I imagine that OMB is going to push for a rule that is fairly similar to what they've proposed originally. And after the fact, while Congress can certainly intervene, I don't think they will do so. I think what's going to happen is we'll see a decent amount of legal challenges and having this challenge through the courts.
And now your World Cup prediction. Who's going to play in the final?
So my prediction will definitely be France, just given the way that they're playing. I think they're a complete team. And then again, up against Argentina, because you just can't ever count out Messi.
Yeah, I think it's a little chalk, but it's a fair, that seems to be the conventional wisdom. I'll go a little differently. So I'm going to say, oddly, that I think England seems to have, no, I'm going to change my mind. I think it's going to be Mexico. I'm going to go with one of the three hosts, and I think they're going to play Spain. So I'm going to predict a Mexico-Spain final, just to be different.
That would be great. That would be a great game.
So Ryan, thank you. Appreciate you spending so much time on this topic. We have been sending out a lot of information to ASM members about this issue, but if people have questions, please reach out to us. We are happy to help in terms of, as you are submitting comments, or if you have questions about ASN's comments on the proposed rule, which we'll also make public, which we'll post on the website every month when we update with different information.